Multnomah, and Clackamas County region. Today we're going to be talking about the training topic for transitioning, helping clients transition between our systems, so our healthcare systems. Specifically, we're going to be talking about transitioning from Marketplace to OHP. I'm joined here with my coworker, Dina, who's going to be helping to field questions and answer stuff as they come up. Sometimes I tend to miss things when I'm talking, so as well as if she notices that I'm talking too fast too, to be able to support us as well. So Dina, thank you so much for being here.
Yeah, happy to be here. I will remind everyone that it is recording now, and I'm just here to provide tech support and keep a lookout on the questions. And I'm putting the registration link for our module series in the chat box right now. So if people aren't able to get in, they can click there and register, and they'll get a link specific to them to join.
Awesome, thanks, Dina. And yeah, and once you guys do that registration, it should put it on your calendar for all of the following ones as well. And then I'm also joined here with my awesome counterpart, Ben, from the Marketplace. So Ben, do you want to go ahead and introduce yourself?
Yeah, hi everyone. My name is Benjamin Becerra. I work with the Oregon Health Insurance Marketplace. I'm the Hispanic and Latino Outreach and Education Coordinator, and I also support outreach for Washington County. So excited to be here today.
Awesome, thanks, Ben. Yeah, it's going to be helpful to have someone here from both sides of all of these healthcare systems, so we can kind of help fit everything together into one piece and hopefully make this module something that flows well and is understandable for you guys. One thing I did want to mention is I know that previously this module series had mentioned that it was going to be both transitions, so a client transitioning from OHP to Marketplace, as well as Marketplace to OHP. We did, through discussions with my teammates and also our policy team, we did end up deciding just to focus on the transition from Marketplace to OHP, so that we can give people an opportunity to focus on just that one piece, that we don't go too much into detail, as well as because of the state of emergency, a lot of folks that would normally be transitioning off of OHP and onto Marketplace, with the pandemic and state of emergency, that's not happening as often. So we didn't want to cause too much confusion talking about, well, in this situation, they normally would transfer, and just to focus on the pieces of folks coming to OHP. Right? So let me go ahead and show the slides. Okay, for the objectives for today, again, talking about the transition between Marketplace to OHP. We're going to go over best practices for helping clients to be successful, going over helpful resources both for Marketplace and for folks helping with OHP, and then a question and answer section. Again, if anything if anything does come up for folks, feel free to throw a question in there. If Dina feels like it's something that we should go over right there at that moment, or I do as well, we will go over that. If not, we'll save it for the question and answer section at the end. Okay. All right, to get us started off, we just have some terminology that we wanted to go over just to help orient folks. There's going to be a lot of interchange and different terminology used depending on what section we're in. So Ben, why don't you go ahead and start us off with the Marketplace terminology?
Yeah, so just a little bit of background. So what the Marketplace is. So the Marketplace allows people to get private health insurance plans for themselves or for someone in their family household. And they can also get financial assistance. And so we in Oregon, for people to enroll in the Marketplace, people enroll on healthcare.gov. So that's the website that they go to, and often then we'll refer to it as healthcare.gov. Oregon is a state that does we're like a little bit of a hybrid state. It's a little bit strange the way we do things with the Marketplace. So we do have staff in our state that work to do outreach, that they manage the plans that are sold in Oregon on the Marketplace. And so they manage a lot of the different functions. However, we do use the federal platform, which is healthcare.gov, for people to enroll. So we are actually in Oregon a state-based marketplace with a federal platform. And so technically that is our designation. We're an SBM FP. Oftentimes you may hear people refer to it as the Federally Facilitated Marketplace, or FFM. I think it's helpful to have kind of a shorthand for the marketplace, but that is actually not correct in terms of how Oregon runs things. We do want to kind of try to shift things a little bit over towards really just referring to it as the marketplace, or healthcare.gov if we're talking about the platform. But we do just want to let you know that you may hear folks calling it the FFM. So if someone's talking about the FFM, they're talking about the marketplace and healthcare.gov, though that is not technically the right lingo.
Awesome, thanks, Ben. Yeah, and you'll see us talk about that as well. We are working with the support staff and eligibility workers in the processing center as well, to try and refamiliarize people with the marketplace as a term versus using FFM, but they have had a lot of education and training using that term. So sometimes you'll see it interchangeably used, even if it's technically not how Oregon's is set up. So awesome, thank you, Ben. And then of course, for Oregon Health Plan terminology, you guys are gonna be very familiar with most of this. I just like to go over things briefly. So of course, Medicaid refers to public health insurance program that provides health care coverage for low-income families and individuals within the U.S. It's the general term that's used for the program across all states within the U.S. And then our local program, of course, is Oregon Health Plan. I like to remind folks about Medicaid and to use the term Medicaid, because when we talk to Marketplace as well, sometimes they are more familiar with Medicaid versus Oregon Health Plan. So sometimes it can be helpful for clients and yourselves to be using both languages and both terms. And especially with Medicaid now, that our eligibility system can help us do determinations for non-Magi programs. So our Medicare savings programs as well sometimes tend to be referred to as Medicaid. Then similar to Marketplace, we've got one.oregon.gov, which of course is where people go to apply for benefits and to get a determination, and we refer to that as the one, or the applicant portal, the one applicant portal. The last two on this slide here are support staff and eligibility worker. So this is just to kind of remind you guys a little bit on who you're speaking to when you call into the Assister phone line, of course, when it's working. For the support staff, when you guys call in, there is an option for case association or getting connected to a case if you have a consent form. If you use that option, you're going to be working specifically with the support staff. So that is their number one job, is to get you connected to a case so that you can see them within your own portal, and that's it. Then of course, when you guys need to work on detailed cases and get things resolved, get applications processed and resolve eligibility issues, you're going to be working with an eligibility worker specifically. They're the ones that are going to be actually going into more detail with your cases. All right, and I don't see any questions so far, so we'll just keep going. So again, we're going to be talking specifically about the transfer between the Marketplace to the Oregon Health Plan. In the example that we're going to be talking about today, and Ben, feel free to chime in if there's anything that I miss in these pieces here, or if there's a section that you'd like to, or prefer to speak to as well. We're going to take an example. Amy's going to be our example for our training today. And she is already enrolled and receiving, financial assistance. She's already receiving tax credits, has an active plan, health plan through healthcare.gov. But as many folks have experienced, she has a drop in income. So maybe she had her hours cut because of COVID, or needed to transfer or change her jobs, and she's making less than she used to. So we're going to encourage her to either call healthcare.gov or to go into her account and report that income change. When that happens, it's going to rerun her potential eligibility. And sometimes if the income is dropped low enough for her to maybe qualify for the Oregon Health Plan, it's going to indicate to her that she may be potentially eligible for state Medicaid, and that they're going to refer that information on. Amy's information is then going to get sent to the Oregon Health Plan, where an actual determination is going to occur. And of course, again, I'm using Medicaid as a terminology here just to remind folks that it's not just Oregon Health Plan, but also some of our other Medicaid programs as well that folks may need determined for. As a side note, the Marketplace Health Plan will remain active until they receive an update directly from Amy. So this is something that has been kind of a common either misnomer, is that even though OHP and the marketplace are communicating back and forth, they oftentimes still require the client to reach back out to the marketplace to let them know did they got approved or did they got denied, and whether they need to cancel their plan. Ben, I'm not sure if you wanted to add anything more to that piece there.
Yeah, just that like really key point with if folks are eligible for OHP. A lot of people, that's a big misconception, that people think, oh, well, these systems are going to talk to each other. So if I get approved for one program, especially if it, was sent through healthcare.gov, it makes sense that healthcare.gov would know what's going on, and they're going to just automatically kind of fix things up for me. And that's really not the case. So that key point that, the plan is going to remain active. So they do need to make sure that they take action depending on whichever eligibility they get.
Awesome. Thank you, Ben. Yeah, and we're going to go over that towards the end as well when we get to an eligibility section, and we can go over what community partners and what you guys can really do to help clients in that transition. Marketplace is a little bit different in that a lot of times they need to call in themselves, and you can't necessarily call on their behalf. So it's good to know what those steps are then, so you can help support folks. A couple of things that we're going to make a note of is that referrals may take 24 hours to show up in the one system, but they are relatively almost instantaneous and automatic. This didn't used to be the case, but with some updates that have recently happened, the marketplace and OHP communicate a lot faster than they used to. But we do ask people, if, say, they update their case, it says, hey, you may be eligible for Medicaid. If they turn around and call you immediately and be like, hey, I think I need to apply for OHP now, it may be good to wait until the next day so that it's actually been received in the system and there's hopefully been an action taken on the case at that point. The final note I wanted to mention is that there is no documentation that has been uploaded. Sorry, this is written a little backwards, but no documentation uploaded to healthcare.gov will transfer to the one system. So if they've uploaded immigration documentation or their pay stubs in the past, that information won't be transferred. It's just the data that is entered in the application itself. It looks like we have a couple awesome questions coming in here, so hopefully we'll be able to look at those. Yeah. And should we tackle those now? Do you think now?
Oh, sorry. Go ahead.
Oh, I was just saying, do you think we should tackle those now or later?
Yeah, they might be applicable. If you're open to it, I can read them off.
Let's do it. Go for it.
The first one is, if someone is not eligible for OHP but cannot afford marketplace plans, what are other options?
That's a really good question. Ben, I don't know if you want to speak to this, because I know that there's been a recent expansion in the amount of financial assistance folks can receive. That might be helpful.
Yeah, I was going to say, so I think recently in the past few months with the American Rescue Plan, there has been anyone who's eligible for tax credits is now, or financial assistance on the marketplace, is eligible for even more than before. So I would say if someone in the past has applied for the marketplace and they felt like that was not affordable for them, I would definitely encourage people to apply again now that the financial assistance has increased for folks. Though I do know that that still may not be affordable for some folks. In terms of if the issue is that they can't afford it, other ways to get health insurance typically are not going to be less costly. I know, because sometimes we get the question of this for folks that maybe can't get assistance, like people that are undocumented, like where can they get coverage? I mean, people still are able to purchase private plans off of the marketplace, though that would be without any financial assistance and can be kind of expensive. Beyond that, then it's really about where can they get care for reduced costs. And that's when we really try to point folks towards federally qualified health centers, low-cost health centers in their area and their community, and as well trying to let them know about financial assistance that's available through hospitals.
Yeah, that's great, Ben. Yeah, especially the hospital piece. A lot of the hospital systems in Oregon. Let's see. Okay, let me know, guys, if you're having any issues hearing me. Just let me know that my connection's a little slow. So hopefully we're doing okay still. Okay, good. They oftentimes can cover almost entire procedures, depending on people's income, and can sometimes cover at least a portion up to 400% of the federal poverty level, sometimes higher. So that could be a really helpful thing as well. And then, Gina, I can answer Teresa's question here, and then we'll move on real quick.
Sure.
So I saw that you mentioned something about the COPA population. So that was a training probably either during collaborative or when folks first transferred in March. For those who don't know, the COPA community recently the adults became eligible for Medicaid and Oregon Health Plan again, starting in December of last year. Many of them were on Marketplace or had Marketplace plans, but were also enrolled in the COFA Premium Assistance Program that was paired actually with Ben's team to help bring folks costs to almost zero, I think entirely to zero, once they got reimbursement for any services that they used. Even with their transition, so for some of the folks, they were auto-enrolled if we identified them as a COFA immigration status and having CALM emergency coverage. But when it comes to disenrollment from Marketplace, it is never going to be automatic. So the way that our system's set up with the Marketplace with healthcare.gov, they may end up losing their tax credits if healthcare.gov finds out that they are eligible for other health insurance, but it's really always up to the client to contact the Marketplace directly, contact healthcare.gov to disenroll and to let them know that they now are eligible for other health insurance once they've been confirmed as having active OHP. Is there anything else you want to add to that, Ben? It's a really great question.
Yeah, no, that's really great. I think we know that we're really trying to get folks over onto OHP, and I think when I last heard, which was a few weeks ago, it was only about half of the people on the COFA Premium Assistance Program had transitioned. But yeah, it is really key that they do still actively cancel their plan with the Marketplace. And so they can do that by themselves, contacting healthcare.gov, or if they're working with a community partner or agent, they can get that help once they get transitioned over to OHP, making sure that their Marketplace plan is canceled.
Awesome. Thanks, Ben. And Teresa, hopefully that helps. And if you have any other questions related to the COPA population, I'm happy to help. If you want to email me afterwards, I can provide you guys my contact information. All right, so we're going to go ahead and transition on and keep going through the training. So with the transition from Marketplace, so just as a reminder, we're at this point, Amy's information has been referred over to OHP, and now we're going to look at what do those referral pathways look like. So there are going to be essentially two referral systems, two referral pathways that a Marketplace referral can take once it enters the one system. So there is something called a systematic process or manual worker intervention. So systematic is what we kind of refer to as the happy path. We don't always use that terminology because it doesn't always refer to every single situation. Systematic oftentimes means that the person is brand new to the system. They have never been had a one application before, or they don't have any other active account, and it passes member match. So we're able to look at their name, their social security number. They're able to ping the hub and find all their information, matches up, and they're able to get a determination. So if a referral goes through systematic, it can be almost an instantaneous approval, or at least a determination where it may ask for more information, but it doesn't get hung up at all, and there's no required for extra work. So we always are hoping for systematic. It's just the nicest, smoothest pathway for everyone involved, including community partners. The one we're going to speak a little bit more to towards a few slides down is going to be the manual worker intervention. So that is when a task must be completed by an eligibility worker before the case can be made in the one system. So sometimes when these referrals come through, either there's not enough data for one application to be fully completed, that client has an active one account already, or they have an active case with other family members because maybe they have children that have an active benefit plan, or say, you know, they have a SNAP or a TANF case. There's a lot more work involved in the back end in sometimes merging cases together, or say if there's a member match issue and there's someone else in the system that has a really similar name or similar social, and sometimes it just needs a little bit extra work. One thing to keep in mind before we move on, that's just good to have in the back of your mind, is kind of depending on where an application gets stuck in the manual worker intervention. The worst case scenario is if right off the bat the system kicks it out and there's no app number, no application number, there's no case number for it. Sometimes marketplace referrals can get stored as a PDF file under the primary applicant's name, which can sometimes complicate things, and we'll go over that a little bit on locating that referral when it's come through. But the most important piece is that working together with the processing staff and you guys helping clients, we're going to end up helping them find a determination either way, no matter what pathway it takes, whether it's smooth or it takes a little extra intervention, it's all going to end up in the same place with some form of determination. Okay, so we're going to follow kind of the systematic pathway of like, what does it look like? How do you guys get connected to cases? Is there certain terminology you should use when working with staff? And then we'll go into the next step of worker intervention. So similar to case association to anything else, one note I did want to make, and Ben, feel free to chime in if you want to mention anything for this as well. A record, so in healthcare.gov, when you're doing an application, there is a spot to potentially indicate that you were the community partner that assisted, or put in your ID number if you wanted to. It's not required. As well, sometimes you can get temporary like authorization for some clients within a marketplace application. We just want to let folks know that that doesn't transfer either. So you're always going to want to be sending in a consent form in order to get associated to those cases. Is there anything you should want to mention for that, Ben?
Just that you should already have one, especially if you were helping them with any of the marketplace side of things, and then you're helping them transition over. It should be pretty easy because you definitely should have had one assigned to help them with the marketplace. But yeah, definitely key to make sure that that stuff, it doesn't automatically transfer over.
Perfect. Yes, and you are correct. As we always drill in your guys' brains all the time, you always need a consent form. And so as we all know, we have the new consent form that we're using. So that's going to be the authorization for community partner help, aka consent. That form is called the 6610. You'll want to have that completed and filled out. You're going to want to send a secure email like you do normally anytime you're working with the processing center. So you're going to want to do a secure email sent to the Oregon.benefits email. And then specifically the things that can make things a little bit easier is in the subject line. You're going to want to indicate consent for marketplace referral, or you could do consent for FFM marketplace referral if you're worried that staff might not be able to fully understand what the request is. And then the body of the email, you're going to want to indicate who the primary applicant is on the healthcare.gov account. So as I mentioned earlier, sometimes it does get stored under that individual's name. If it's early on in the process, as well as the estimated time and date of the marketplace referral. So roughly when the person submitted the application. So, maybe it was a week ago, or maybe they did it yesterday, can be a little bit helpful, just to be as clear as possible for staff. And then of course to attach the signed 6610 and go ahead and send it on. And then if you need to get associated quickly and you don't want to wait for that email to kind of be processed in the 1 week time frame, roughly where the processing staff is at the time, you can always call in the CP Assister line. I know it's not quite functioning as we would like today, but that is still the best way for you guys to be able to get connected to cases. What I'm first going to recommend is there are always two options for you guys when you call into the Assister line. There is one to go in and process an application to work with an eligibility worker, and then there's support staff and getting case association. So the case association is, I believe, option 2. So you're going to want to select that first because usually there's very short wait times for case association line. You are going to be working specifically with support staff. So as we spoke to earlier, support staff are only able to do case association when they're working with community partners. So you're going to want to let them know that it's a marketplace referral, aka FFM. You just emailed the consent form in roughly when you date and time, and then you need to get associated to the case. So if that referral has gone through the systematic process, it's been super smooth, and a case has been made, they should be able to find that application, attach you as the Let's Community partner, and you should be able to see it in your applicant portal. At that point, you know, if you need to take any more action on the case, you can move on to work with an eligibility worker. But if everything looks good, then you can just work with the client in doing any updates to an application if they need it. But as we have a note here, as we mentioned, sometimes there's going to be an action that's going to need to be taken, or it has gone kicked out into the worker process. So we're going to go over what those next steps are going to look like. Team School Tribal. So Paula, it's your email. Yeah, so if you are working, there is, and I apologize, I know I just put the Oregon.benefits email line in here, but as you guys know, in your community partner kits, so the starter kits that we have for you guys, there are the tribal line, the pregnancy email line, there's quite a few others, and there are a few others that you can send consents to, and I do recommend if you are working with tribal members, that you go ahead and email it to the tribal line, just because things can get a little answered faster, and they have dedicated teams to process those as well. So great question. Thank you, Paula, for bringing that up. All right. Let's see, lost my mouse here. Here we go. Okay, so manual worker intervention. So as we mentioned, sometimes you're going to call in and they're not going to find that application because it hasn't been processed far enough. So you may want to ask, you're still on the phone line with the support staff, you're going to say, hey, would you mind transferring me to an eligibility worker? Because you're going to need a little bit of extra intervention, a little bit extra support, more than the support staff is allowed to do. So you're going to say, once you get transferred over and you're able to talk to someone, you're going to inform them very similar stuff. So you're going to say you're working with a marketplace referral that has not created a case yet. So that helps them to know that they need to look in other areas. I think there's 3 different places that they can potentially look for a marketplace referral. Don't hold me to that, but I know there's at least a couple spots if it hasn't formed an actual case number yet. The eligibility worker will need to get a lead in order to access the secure email and access your consent form. I know you guys are probably familiar with that process at this point. I know it causes a little bit extra barrier, but trying to make things a little bit smoother. And then, of course, you're going to spend time working with that eligibility worker to process that application. So helping to identify any information that needs to be filled out, seeing if it was maybe it's just a member match pinned, and they can work with you to help merge cases, clarify any issues. Now remember, even if you do get a application processed all the way down to and you submit the application, there still may be some extra steps for folks. So as quick and as smooth as we want this to be for clients, because our system is more complex and needs to do sometimes an interview for folks if it's a non-magi, long-term care services, or some of our other eligibility programs might need a little extra step, or there may be a request for information if they need clarification or need to submit their immigration documents. So it's good to work with the eligibility worker all the way through to as far as they can go to find out what your next steps are going to be. Now, that is when things are hunky-dory and they're able to find the application, they're able to help you process it and get it done. Now, I know that that isn't how the world always works. So there may be some chances or some times where you get to the eligibility worker and they're still not able to find it. So we wanted to leave things up to helping you kind of figure out what's going to be the best next steps. So I always recommend, if you're unable to locate the application, just ask the eligibility worker, see if they want to work with their lead or talk to their lead, and see what are the best next steps. It may be a CA ticket, which is a tech ticket to go and find the referral, or it may be a new application in the one. I know that our processing staff are really trying to, at this point, really deter community partners from submitting new applications if there's another one floating out there, because it just makes duplicate work. I had one time a client that had a marketplace referral sitting around and it was missing some data. And when that got connected with their current one case, it accidentally removed them from their current case because they thought this new referral that had come through that they were the only household member. So it's good to make sure that we're following these steps as best we can. Even if it does those things down, it can make them easier in the long run. All right. So that is the process. That is what we're the best way for you guys to be able to contact the eligibility workers, the processing staff, the best way to set yourselves up and set clients up for success. So now we're going to kind of transition and talk about what do we do once we get that determination. So if someone's been eligible for a Medicaid or eligible for the Oregon Health Plan, or if they're determined ineligible for all medical programs, what are the next steps? So let's see here. So I'm going to have Ben, why don't you tackle the first post-enrollment step, and then I'll walk through what you need to do in assisting the client on OHP side.
Awesome. Yeah, absolutely. So now we're looking kind of first case scenario if their information is transferred over to the Oregon Health Plan and OHP says you are eligible. So remember earlier I emphasized that their marketplace plan just would continue active unless they take action. So it is really important that once they have that date, that start date for the Oregon Health Plan, they know that they're approved, then they want to call healthcare.gov and indicate that they have been approved for Medicaid and provide a cancellation date. So that's something they can do in their account online or calling healthcare.gov and making sure that they give them a date to cancel their marketplace plan. And then beyond that, they would also make sure that they would report a change in the one system and provide the end date of their marketplace coverage.
Awesome. Thank you, Ben. Yeah, so those are really the number one steps. And really, as soon as someone knows that they're eligible for OHP, they need to take that next step. Even if it, they're not 100% sure, we always recommend just calling and double checking, making sure that that plan is canceled, make sure they've selected the cancellation date. They can specify when they need it to cancel. But yeah, that once it has been canceled, or at least that cancellation date has been submitted, you really need to make sure that it's reported within the one system so that OHP and the state does not think that that person has other health insurance. A lot of our systems, as you guys probably have learned, are a little slow sometimes in the fact that they're not necessarily actively looking or pursuing whether someone has other health insurance or whether that health insurance has ended. So it can be really a slow process to get it removed. But there's ways you can help to expedite that and help to make sure that the system doesn't believe they have other active health insurance or other private health insurance, so that they don't get stuck on open card and OHP is in secondary, and that they actually fulfill the whole enrollment process into a CCO or coordinated care organization. So I always recommend first making sure it's been reported in the one system. You could also send a secure email too, if that's faster for you, to say, hey, just want to let you know this is the client's end date for the marketplace plan. They can go in and check to see whether that needs to be put in there. And then if you need to urgently enroll someone in a CCO or urgently get them onto OpenCard, you can either call or email the health insurance group, the HIG. A lot of you guys may know them as the reporttpl.org website, but you can contact them and indicate the detailed information about their health coverage and when it ended, and indicate that it's urgent, and that can help speed up getting a secondary insurance removed. And then as the last step, things that you guys can help with is working with the Client Services Unit or CSU and we'll have all their phone numbers at the end. They can help with both care coordination when folks are on open card. They have an entire team dedicated to it. So if someone has dialysis or really urgent care needs, they can support, as well as you can ask them about expediting CCO enrollment. And sometimes they can't actually do that, especially for if they can't get the care that they need on open card and it's urgent, they can help to work with the CCOs to get them enrolled faster. Okay. Now, the next thing that we are going to talk about is sometimes, as you guys I'm sure are familiar with, clients may not have known that, or they didn't work with a CP and they didn't know that they needed to contact Marketplace to cancel their coverage or end their coverage. So sometimes you can end up with dual enrollments in OHP and Marketplace. So I'm going to have Ben speak to that a little bit.
Yeah, and so this, the overlap between OHP and the Marketplace sometimes can cause issues for clients, especially kind of depending on how long that coverage overlaps. And certainly, so sometimes those issues can align in terms of being with coordination of benefits. So, for example, you know, if they have OHP and the Marketplace plan, OHP is supposed to be paying secondary. If they're having kind of issues, then being able to get into a CCO because they can see that they have other Marketplace coverage. Kind of these are some of the things that might be barriers for people in being able to really access their benefits if they do have that overlapping coverage. And another really key part is that with people that are receiving financial assistance on the Marketplace, if they have other coverage while they are receiving financial assistance, they're not eligible for that financial assistance. And so depending on how long that overlap is and depending on the type of coverage, but with OHP, there are certain protections in place, but it certainly doesn't extend to, you know, if they just keep having overlapping coverage for several months, they may not be protected in the same way. And so people may need to pay back some of that tax credit that they received during months that they weren't eligible. And so it is, they may not necessarily owe that money back depending on how their tax refunds go, but just overall, it may affect if they were not eligible for that assistance and they were still receiving it, that's where that can kind of become an issue. And so those are the cases, especially if that coverage overlap is with the Oregon Health Plan. There is a process that our team can help retro terminate Marketplace plans, so that way they end earlier than the actual date that they were requested. And so I'm just going to talk a little bit about what that process looks like. So like I mentioned, this would be used only in the cases where there's the overlap of OHP and the Marketplace coverage. Either it's for multiple months or that overlap results in some type of hardship. And this process can really only be done through a community partner or agent. So if the consumer needs help with this, they do need to work with a community partner or an agent to be able to go through the process. And so just to give kind of an example of like what's a common case that we may be talking about. So an example where someone has coverage through the Marketplace and they update their application based on that new information, they say, you know, you might be eligible for Medicaid, so they send that information over to the state for the determination. And in this situation, they find out on the 20th of May that their OHP coverage is actually starting on March 1st. So at this point, they're in mid-May, their OHP coverage starts March 1st, so they would already have overlapping coverage for March, April, and part of May. So this is a situation where that would be pretty common, that they might want to retro terminate their Marketplace plan. So that way their Marketplace plan would end at the end of February, and their OHP coverage would start March 1st, and that way there would be no overlap. And in terms of how to actually do this process, so through you as a community partner can help them request that retro termination. You do need to provide several different documents to do this. One being the authorization for community partner help, the consent form or the 6610, as well as the eligibility notice from the Oregon Health Plan, information about the information about the health plan that they are enrolled in, as well as the eligibility notice from the marketplace. Oh, did not mean to start my camera. And this can be sent to customerservice.marketplace@oregon.gov. So you would send over that information, and then the marketplace team would review it and be able to, and then determine if it meets those criteria, and if so, kind of be able to retro terminate that plan. I see a question or a comment in the chat box. OHP always backdates to the beginning of the month. When we call the marketplace, they cancel the day of the call. Always has to be retro terminated. So if it is within the same month that they are canceling their marketplace plan, that small amount of overlap, even if their OHP is retro starts to the beginning of the month, that small amount of overlap is not going to cause any issues in terms of the tax credit issue. The marketplace, people are still eligible for the tax credit until the month after they get their OHP notice. So for example, if someone, well, now we're June 1st, so this is bad. Let's say if someone applies in mid-June for OHP and they do, or they report a change to the marketplace in mid-June, it gets sent over to OHP and they're approved starting June 1st. As long as they cancel their plan before the end of June, they wouldn't have any issues due to that overlap with regards to their financial assistance or tax credit. So it doesn't have to be every single case, but when it does cause that hardship, that's when you may want to look into it and get more information.
Awesome. Thank you, Ben. That was fantastic. Thank you and Linda, thank you for making that comment. I think that's a common thing that folks get a little bit confused, and it's although we don't want necessarily clients to think, oh, I have extra time before I need to cancel my plan, but it's nice that there's a little bit of a buffer built in to help protect folks as well.
Okay, great. And then so we look first kind of, oh, this is me still, right?
Yeah, this is you. Go for it. Sorry.
Okay, great. No, that's great. So now with we looked at the case where OHP says yes, they are eligible. So now we're gonna look what happens if they say OHP says that person is not eligible. So remember, the healthcare.gov plan is still active, but they are still going to want to call healthcare.gov. And the reason for this is that when they reported that income change and their application gets sent over, the marketplace is not, based on that new income, figuring out what their financial assistance should be. And so if they just, don't touch their application, they would continue kind of receiving the same amount of assistance that they had before. And it's very likely, since their income drops, that they're actually eligible for more assistance. And so we really want to make sure that they go back in and indicate that they were denied or not approved for Medicaid benefits. So they can do that, either they can call healthcare.gov or do that within their account online. And I think especially for folks that are going over, it may be helpful to call healthcare.gov and just really make sure that the information is entered correctly in the application. So if the income that they put in before, is that still kind of their best estimate? Because now once they say that they have been denied Oregon Health Plan, the marketplace is going to look at that income and create a new, determine them for financial assistance again. So we want to make sure that they're getting the right amount of financial assistance by reporting that to the marketplace.
Awesome. Thank you, Ben. Yeah, I think that's another thing too. We just really wanted to touch on, with these systems, it is always good for clients to follow up and get questions answered, to double check that their determinations were correct, that they, should they be qualifying for more financial assistance? Because, as you guys mentioned earlier, it really, especially financial assistance, if they're not getting the correct amount, that can be the difference between someone keeping their plan or not keeping it, or canceling it because they didn't realize they were eligible for more. So it's just good, you know, whether we're trying to find out whether they qualify for OHP or Marketplace, as much as we can help guide people through this process and help them know what their next steps are going to look like, the smoother it can be and the more likely they are to feel supported and to keep their coverage, which is our ultimate goal, no matter where they are. And then Alexander, you had a question in there as well about does OHP honor retro termination requests, same as FFM? So that is a great question. We are looking into that. There is a potential, I think. There's a couple, we're still working on figuring out exactly what the parameters look like. And so I know that Ben's coworker, Marina, has been working with OHA's policy team to try and figure out what that looks like. So we are hoping to have more information soon, but I don't want to talk about it too much now. But there is a potential option. We just want to make sure we get things spelled out a little bit clearer. I didn't find out about this until last Friday, so more to come on that. And I think that's a great question. I'm glad you asked it, because you know, it can create some complications when you do a retro term for a Marketplace if they stop services during that time frame of overlap. So we want to try and find the best options for everybody wherever they fall. So perfect, great question. And then the last thing, guys, that is coming up here towards the end of our training. Thank you for sticking through with us all the way through. I know it was a little bit longer. Some of these usually are only like 15 to 30 minutes, but I hope you guys found this valuable. The last slide that we're going to talk about is the resources for you all. So Ben, do you want to talk about the first two, the Marketplace resources?
So first we've got the contact information for the Marketplace, and this one specifically being for healthcare.gov, the platform where people can actually enroll. And so healthcare.gov is where they'll have their application, their account. And there's also the phone number listed there, the 1-800-318-2596. That's how people would call the healthcare.gov to be able to report changes to their application, cancel their plan, answer questions, similar things like that. Then there's the Oregon Health Insurance Marketplace, and so that's going to be information from our state agency. We do have a resource center which has all kinds of helpful documents and resources, both for application assistance, but also for outreach. We have an email inbox that's dedicated for our community partners, and so you can reach out to that email as well. And you can also give us a call. We always have someone from our outreach team on the Marketplace phones that's available to answer calls from community partners, as well as always, you're welcome to reach out to our regional outreach and education coordinator with the Marketplace, and any one of us would be happy to help point you in the right direction and help you get started. So a plethora of ways to reach us and get the help that you would need.
Awesome. Thank you, Ben. And then the last three resources are OHP related resources. So as I mentioned, one of the pieces that are really important after someone gets an eligibility determination for OHP and they're eligible is after ending their Marketplace plan, they're going to want to make sure that the state knows that that other health insurance is ended and removed from their account, so the person doesn't get stuck on open card because they might believe that they have other health insurance. So health insurance group, the HIG, is there to add, remove, or update any private health insurance that someone has or used to have previously. Their website is www.reportcdl.org. You can email them and you can call them. I know that there is an online form on the website, but it can be a little slow, so I oftentimes call them. There's great staff. They are there to really help support, and it's a difference between someone getting stuck on open card for months and you guys being able to help with that last process of getting that the private health insurance removed so that they can move on to their CCO. Then, as I mentioned, the client services unit, so they're the ones that can help with open card and helping people with care coordination, and helping expedite CCO enrollment. Or if you're unsure, say even you're just like, okay, this person should have moved on from to a CCO by now, what's going on? You can always call the client services unit as well. And they should be able to let you know if it's getting hung up from that the system believes that they still have a marketplace plan. Okay. And then the last is Open Card Care Coordination. That's the 24/7 nurse advice hotline. So they're the ones that can help people get medications, get connected with providers or doctors if they have any immediate needs once they're immediately enrolled into OHP. And then that was all the resources that we had, and we are at the end of our training here. So I'm going to move on to our questions slide in case there's anything else that folks had. I know that we were able to answer things kind of as we were going through, so I hope that folks found that helpful. So let's give us a few minutes if anybody has any other questions. And if not, we'll go ahead and wrap it up for today. Okay. It's also that like need a little bit of Jeopardy music, I feel like, while we're waiting. Okay, I don't see anything else coming in. Oh, absolutely, Paula. No worries. I hope you guys found this helpful. Okay, so I'll move on to our final slide here, to our thank you slide. Again, as you guys know, we have these module trainings, the first Tuesday of every month. Please come back and learn more. Ben, thank you so much for being here and being my co-partner. Dina, thank you so much for helping on the back end in case we had any extra stuff come up. So we had a good team today. Of course, guys, thank you for coming. As a reminder, we are going to be following up with more information in regards to this training. So as you guys know, we need to talk about next the transition from OHP to Marketplace. We are going to reserve that until later in the year, maybe, depending on when we're coming out of the state of emergency. We don't have any information on that yet, but we want to make sure that you guys have up-to-date information on that transfer when it's really prevalent and important for community to know. All right, anything else that you want to add, Ben?
I think this is it. I think that thanks all for your interest in learning more about this and for being such great advocates for all of our consumers and navigating these really complicated, messy systems that don't talk to each other as well as they should. So thank you for helping be the middle person in all of this.
Awesome. Thank you so much, Ben. And as again, guys, before I head out, there is the handout. The PowerPoint slides are in the training here. You can download those, but if you don't get an opportunity, I'll be following up with an email. Just a short reminder, a list of those resources, Ben and mine's contact information in case you have any follow-up, because I know sometimes it can be difficult to talk about any particular detailed cases in these shorter trainings. So, and then Dina, do you want to go ahead and stop the recording?
Yeah, great job, guys. I'm stopping the recording now.
Sweet.